Hi guys, this is me Gayatri Agal and welcome to Quality Online OET. So, എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today we are going to discuss about 14th of October 2023 OET exam, in which we are going to discuss about OET writing. There were two letters asked on the day of the examination. One was a known case letter and another one was an unknown case letter. So let's see one by one. So first case letter was an unknown case letter. This letter is writing to a district nurse about the patient condition and the treatment, and then she is going to do a follow-up care and treatment management for the patient. So let's move on to the case note. So here, as per my students, the case note, the patient name is Mrs. Belfort, and also she is a teacher and she is living with her husband, and she has one son who is living nearby. Regarding her past medical history, she is an asthmatic patient and she is on treatment for the same. And on 16th of December 2022, she was noticed a lump in the breast. Thereby, she has undergone for an investigation, in which specially she just gone for an ultrasound and also she gone for a biopsy. In that biopsy, she came to know that she has a nodula. So she was admitted in the hospital on 30th of December 2022 for a mastectomy. And then 31st of December, she was performed with the left breast and nodular clearance surgery. So they have inserted 2 drainage and it was on continuous monitoring. On the day of the discharge, her wound drainage was 90 ml, and then she was referred to an oncology nurse for the further care and treatment. And at the time of discharge to the home, the main instruction was given for the nurse to monitor her continuously, and also when the drainage goes below 30 ml, it has to be removed. So these all are the instructions was given to the district nurse. So now we are writing a letter to a district nurse for the further care and management. So now, first of all, when we are writing a letter, first main thing is we have to write a date, either date, nor we are writing the addressing person. So here, if you want to write, we can write the date on the top of the paper, and then we can write the addressing person. So in the addressing person, when we are writing, we always must to look for that if they have given the name of the addressing person, we can start the name first. In case if they not given the name of the addressing person, you can start the designation of them. For example, if they have given the name of the district nurse, you can start with Miss or Mr. so-and-so, and then you can write district nurse. In case if they not given the name, you can start the district nurse and you can write the remaining address one by one. And then we have to write the salutation, which means if they have given the name, you are writing the second name, like starting like dear Mrs. so-and-so. If they have not given, you can start with, we don't know the gender, so better to start dear district nurse, nor you can write dear sir or madam. And then we are writing the reference. In the reference, we are writing the patient name, and then we are writing the age. Either if they have given age or date of birth, what they have given, we can write it that one. And now coming to the point of your introduction. So to make an introduction, always we needed 3 main informations from the case note. One is your patient full name. Another thing is what is the diagnosis or what is the current condition of the patient. And third one is a purpose. So here you are writing a letter to a district nurse about the patient condition and why we are calling the district nurse for the patient, which means to monitor her continuously and also to watch for the wound drainage mainly. So here we can write, I am writing to refer or I'm writing to introduce. If you don't want to start with these kind of format, you straight away can start with Mrs. So what is her name? Mrs. Belfort. And then you can add the surname, because I didn't get the surname from my students. Only I got the first name of the patient. So you can start with Mrs. Belfort so-and-so. Then you can write who is recovering from, because she finished her surgery, so she is in the recovery stage of her surgery. So who is recovering from so-and-so surgery, full stop. She requires your continuous monitoring and wound care management. That's it. Now coming to the point of present medical history. So in the present medical history, we have to start from the date of admission to until date of discharge. So when she was admitted, on the time of admission, what was her complaints and what was the investigation done for the complaints and what was her diagnosis and what surgery she has undergone and what was the post-operative period and what's the medication management and the drain management, and everything has to be elaborated one by one. So she was admitted on 30th of December 2022 with the complaints of a cyst on her right breast, and she has undergone for ultrasound and biopsy, which was positive for the right breast nodular. Hence, she has undergone for so-and-so surgery and she was inserted with a true drainage, and at time of discharge, the drainage was 90 ml. So like that, the story has to become step by step, one by one. And then you are coming to the social background. As the district nurse is new to that lady, she must know what is the social background, who is living with her, and how she is going to manage at home after being discharged. So she must know about all those things. So she is living with her husband, and then she has a son who is living nearby. And then if she has any past medical history, as she has an asthmatic patient, so she is an asthmatic, and what kind of the medication she is on for the same. So this all things has to be elaborated in the social background. Now coming to the recommendation paragraph, what this district nurse has to do for that patient once she is being discharged from the hospital. So what she can do, she has to do a visit her at home, and then also she has to monitor her condition. At the same time, she must to monitor the wound drainage, and when it's reached below 30 ml, that it is important for her to remove the drainage. So these all are the main important points that the nurse has to do for the patients once the patient is getting discharged from the hospital. And then we are coming to the salutation in conclusion, like please contact me for further clarifications. And then you are winding up the letter. After the conclusion, you are just writing the salutation like you are sincerely or faithfully. So when you will write the sincerely, when you have the discharging person, when you have an addressing person name given, there you have to wind up the letter with yours sincerely. If they're not given, only they have given only district nurse. So in that situation, we are winding the letter with the yours faithfully. So this is the way the letter has to be narrated, and these are the important points that we need to add in this letter. Okay, so this is about the unknown case letter of the patient. And now we are moving to the known case letter. So what was the known case letter? So here patient is going back to the home care management. The patient was in the home care, and then now the patient is getting discharged from the hospital and going back to the same place where the patient was lived. So which means it is a known case letter. When we are writing a known case letter, that time itself we have to keep it in our mind. One point is totally we have to skip the social background of the patient, because in the known case letter, people definitely will know about the social background and the past medical history, medication history of the patient. But one information they does not know, one history they does not know, which is their present medical history paragraph, and they does not know what they have to do once the patient gone to their care. So the present medical history paragraph is very important to know, and we are updating about the patient condition and their needs. And the recommendation paragraph, we are updating what they have to do, what they have to do follow up about the patient, that all the information we are giving to them. So only these informations are very important, and the social background is not at all important. It is not necessary also include in the letter. This is the known case letter, we will say. Okay, so let's move on to the case note. What was the case? So here we are writing a letter to the home care management, refer back letter for continuing care and management of the patient. Patient name is Elizabeth Simpson, and the patient date of birth they have given March, but I'm not quite sure about the date of birth, and March 1984. So what is the medical history of the patient? If you ask, confusion, deterioration, and then disorientation, Alzheimer's disease, dementia, incontinency. So on 5th of January, patient was admitted to hospital following a fall, and they have suspected it could be a wrist fracture and a dehydration. So they have done an X-ray. In the X-ray, they came to know that patient has fracture, and it was confirmed by an X-ray. And also she was presented with the complaints of incontinency, low water intake, and also risk of urinary tract infection. So the management what has done for the patient, initially they have applied a sling for her, and also they have changed to plaster of cast, and then she was ambulated. Slowly she was ambulated, and then she was incontinency, and then patient was reluctant of wearing the incontinency aids. And also patient started with the treatment of saline, which means normal saline has given antibiotic of amoxicillin. And also she was controlled her pain with the help of paracetamol 500 milligram 4 times in a day. And then also she was recommended. So what she was recommended for, check for the hydration, because she is taking the water very low amount, and also pain monitoring, and if required you can administer Brufen for her, and also she has a follow-up visit in the future. So here the main purpose we are writing this letter for the further care and management, also they have to continue monitoring her needs. and the pain score. Okay, so now here we are writing the letter to the community care home. Okay, so first thing is writing the date as usual on the top of the letter. Which day you are writing the letter, that is the date you have to write it. Don't mix up with which day your patient is getting discharged and which day you are writing the letter, because in some case patient might be discharged after 2 days, but you are writing the letter priorly before the 2 days. So that time you have to write which day you're writing the letter, not the day when the patient is getting discharged. So we have to be very careful when you're writing this letter. Okay, and then we are writing the address of the addressing person address. So whom we are going to write is the home care management person address. We are writing the address, and then we are coming to the salutation, and then patient name and the age, and we are coming to an introduction. So here you are not newly referring. So here you are just updating about the current condition of the patient, because it's a known case letter. They know about her, but only the thing you are updating the current condition of the patient. So how we can start the introduction here? I'm writing to update the current condition of Mrs. Elizabeth, who is recovering from post-fall injury. If there is an injury, so you can write who is recovering from post-fall injury, or that who is recovering from a right wrist fracture. Mainly the right wrist fracture you can write it rather than post-fall injury. You can write post-fall injury also, or else you can write the right wrist fracture and then full stop, and you are just writing that she requires your continuous monitoring and pain management. She requires your continuous monitoring and pain management, because they specifically mentioned in the recommendation that if the pain is increased, she has to be given Brufen, which means the pain monitoring and the management is very much important for her in this situation. So that you are highlighting in your introduction paragraph. Now coming to the present medical history paragraph. So when she got admitted, how she got admitted, and what is the complaints, and what treatment has done, what investigation has done, what is the diagnosis, what was the management given to her. This all has to be narrated one by one accordingly. So we can write Miss Elizabeth was admitted on so and so date following a fall, and what we have done, therefore she has undergone for an X-ray, and it was confirmed and it was diagnosed, and it confirmed the patient condition as right wrist fracture. So what we have done, therefore she was applied the plaster of cast, and also she was ambulated with the help of physiotherapy, and then her pain was managed with the paracetamol 500 mg for 4 days, and also she was prescribed antibiotics to prevent the infection. Okay, and then what else they have done? Apart from that, she presented with the complaints of incontinency and recurrent urinary tract infection, and also decreased water intake. So she was initiated with the IV saline also they have started, but however the patient refused incontinency aid, and then now she is getting discharged as she showed good progress in her condition. She is being discharged to your care. Now here you no need to write the social background. As I mentioned earlier, it is a known case letter. They definitely know about her background, so they don't want to know about it again and again, and also they don't know about only the current condition of the patient. And then coming to the recommendation paragraph. So what you can write it in the recommendation: kindly monitor her pain score, and then if the pain level is high, please provide her tablet Brufen to manage her pain. That is a one. And second thing is kindly monitor her hydration level, as she is having a less oral intake. So that's the main reason. And also she has a follow-up visit, which day that has to be mentioned it. So these all other informations are more than enough for this letter. We can write it in a very good way. Okay, I hope you all find an idea about how to write a known case and unknown case letter of 14th of October 2023 exam. So in the future also we'll discuss more about other upcoming exam letters. Okay, and I think this discussion might help you all to get a knowledge regarding how to write a known case and unknown case letters. Okay, if anybody wants to join in our class, our number has given in our description. You can contact us for any details of the classes, or if you want to join for the class. For example, we have 10 days, 20 days, 30 days, and we have a crash course, and also we have a classes separately for writing and speaking, or 2 modules together also, and also we have a beginners classes also. So if you want to join in our class, you can contact us at any time. So until then, bye bye.